guys, and welcome to the StudyTube project. My name is Tolu and I am a first year medic, and rather than continuing to make some anatomy videos, I wanted to push that aside and try something new today. So in this video I'm going to introduce you to the idea of medical ethics. As a doctor, your role is to look after your patients, and that's done by providing them with the utmost level of care as well as advice and suggestions for their own lifestyle. There are certain concepts that should be at the forefront of a doctor's minds because that will essentially influence the decisions that they take when it comes to treating their patients. These concepts are called the 4 pillars of medical ethics, and they are beneficence, non-maleficence, autonomy, and justice. Throughout this video, I'm going to go into a little bit of detail about all of these 4 terms and provide some scenarios that you can think about. So the first term is beneficence. Beneficence is the idea of doing good. However, there is so much more to it than that. As a doctor, you're supposed to be doing good for your patient anyway. So what does this term actually mean? Think about what treatment you offer would provide the best solution for your patient, what will actually benefit their lifestyle and ensure that they are happy with the overall outcome. Is the form of treatment you suggest suitable for their lifestyle? Will it negatively affect their future? And so on. The aim is to provide a treatment that benefits your patient, so it's important to continue to think about that when you're making decisions. Here's a scenario to help you think about what the idea of beneficence is all about. Let's say you're a doctor and you have a patient who comes in, a child who has an open wound fracture. They are bleeding very severely and their patients are very worried, which is rightly so. They want immediate action for their child. Now, there are a number of potential treatments that you could offer. However, which one should you actually choose? The first form of treatment you think of is amputation. Now, this is probably an extreme solution, but you can think about how using amputation could benefit the patient. The severe bleeding could potentially be life-threatening for that child, so through offering amputation, this could be reduced. The risk of the spread of infection can also be reduced, so to you this may seem like a credible and plausible solution. However, let's think about how that child would benefit or potentially suffer from amputation. Having their leg essentially removed could be devastating to their future and lead to potential mental health issues that the child may experience when growing up. They'll have to adapt their lifestyle and have to become used to only having essentially one leg. Now, do you really think that that's an okay solution to offer? In some instances it would be. However, there are so many other forms of treatment that you could consider. This includes providing the child with blood clotting factors to reduce the bleeding, as well as offering orthopedic surgery to help sort out their fracture. So now you've got 2 options: amputation or the less extreme form by using blood clotting factors and orthopedic surgery. Look at how these options would benefit the patient and choose the one that will help them the most. And in this instance, it would probably be the blood clotting factors and the orthopedic surgery. The reason this is chosen is because it's seen as doing more good for the child, and this is an aspect that's so important when it comes to making decisions. You can have a range of different treatment options ready for your patient, but you have to choose the one that will do the most good and most benefit your patient. So that's what beneficence is essentially all about. Next we have non-maleficence, which is the idea of doing no harm. Now, the idea of non-maleficence and beneficence are sometimes considered to be inseparable, because if you're doing one, you're also technically doing the other. For example, if you're thinking about not doing harm for your patient, at the same time you're also thinking about doing good for your patient. However, sometimes there are instances where you have to consider one more than the other. So with non-maleficence, is the form of treatment you're offering going to do more harm than good? Through doing this, then you can decide what you actually want to provide for your patient to give them the best outcome of treatment. Non-maleficence, however, doesn't only have to deal with physical harm. The patient's emotional and mental well-being, as well as their own personal beliefs, will also come into play when considering non-maleficence. For example, religion plays a huge role in trying to figure out what treatments you want to offer for your patient. Jehovah's Witnesses, most of them don't believe in the idea of using blood transfusions. So if you were to have a patient come into the hospital with severe blood loss and they so happen to be a Jehovah's Witness, you would not offer blood transfusions as a form of treatment. If you were to use this as a form of treatment, you would then be doing harm to your patient because you are disregarding and disrespecting their belief. Next up, we have autonomy, which is the idea of respecting your patient's beliefs. As a doctor, you can provide treatment, you can give them suggestions and advice. However, the patient doesn't actually have to follow through with what you have said. They don't have to agree with the treatments that you've suggested, and it's completely their right to do so. However, it's important to note that some people are not in a competent state of mind to be able to make autonomous decisions. This includes people who are potentially intoxicated or may suffer from particular mental health conditions. So when considering treatment for a patient and whether or not you go through with something, that should also be considered. When you consider the role or the duty of a doctor, you're expected to outline the overall benefits of providing a form of treatment as well as potential risks. The patient themselves can then weigh out whether or not they want to follow through with it, and it's completely up to them if they want to do so. As a doctor, you can't intervene and you must respect this decision unless they are not competent to make their own choices. If people aren't necessarily competent, then potential proxies or next of kin or other people who are legally able to make decisions for them can do so. However, at the end of the day, it's up to the patient's decision if they are competent and able to essentially provide what is called consent. Now, consent is a very, very, very big thing that needs to be respected. If a patient doesn't agree to a form of treatment, then they have not given consent. If they don't give consent, you don't follow through with that treatment. Otherwise, you will be breaching regulations and guidelines and could potentially be criminally charged. The last pillar of medical ethics is justice. And this essentially revolves all around the idea of the law and doing what is compatible with a person's rights or beliefs as an individual. An important example of doing things that are in line with the law is the idea of patient confidentiality. When treating patients or handling particular conditions or scenarios, you're expected to keep the information of the patient secured and private. Patients have trust in their doctors and the confidence that they will keep their information safe and not in the hands of people who don't necessarily need access to it. So as a doctor, you're expected to make sure that their records are safe, that it's not left anywhere so that random people can get access to it, and to ensure that the information that patients have provided for you is kept safe. Breaching the idea of patient confidentiality can lead to disciplinary action. This is because many medical groups and councils set about these rules for a reason. So for example, in the UK, the General Medical Council makes it very apparent that the idea of patient confidentiality needs to be considered and met. Now I'm going to give you one last scenario to sort of explain how to tie all of these aspects together, because considering ethics is so important and necessary when it comes to being a doctor, because it helps to influence your overall decision. Let's imagine that we have a patient who is diagnosed with HIV. If not treated or considered or even acknowledged, could potentially be quite damaging to a person's life, not only on a physical sense but also in an emotional and mental sense too, because a lot of people understand the implications of having HIV, and it could potentially be quite upsetting if they were to find that they have that condition. So this patient comes into your GP or your hospital saying that they have HIV. However, they have not disclosed this idea to their partner. Now, as a doctor, you understand the risks of HIV and how potentially detrimental it can be on a person's life. The doctor needs to fully inform the patient of the overall risks of having HIV, and at this current moment in time potentially also encourage them to tell their partner about this diagnosis, because keeping it silent may potentially lead to detrimental harm and effects to their partner. However, it's up to the patient whether or not they want to disclose this to their partner because of the idea of autonomy. As a doctor, you're expected to respect their wishes and their beliefs. However, the idea of autonomy is not completely absolute. When considering cases where potentially other people are at risk, it's important to note that a doctor can take the necessary steps to ensure the safety of this other person. Now this is where justice comes in, because by doing so you're potentially risking breaking patient confidentiality. Of course, this will affect the doctor-patient relationship, which you're supposed to uphold, but as a doctor you have a duty of care to look after people and look after others. So knowing this person has HIV and has not disclosed it to their partner, it's just very difficult, and doctors have to deal with these sorts of situations all the time. So I just wanted to make you guys aware of the decisions that some of them have to potentially make. Now we can consider the other two pillars of medical ethics, beneficence and non-maleficence. The doctor is supposed to provide the best care for their patient. However, this also contributes to the best care of other patients too. In knowing that your patient has HIV and doesn't want to disclose it to their partner, by not saying anything, you could be considered by not doing good and not abiding by this pillar, because you're putting another person at risk. However, if you consider non-maleficence, by disclosing this concern and potentially breaching patient confidentiality, you're at risk of losing trust and essentially destroying the doctor-patient relationship that you've built. So this scenario is very difficult. Like, it's very difficult. You just have to be aware of potential ramifications when it comes to decisions that you make. Well, I hope that through this video you have now sort of started to understand the idea of medical ethics, because it plays such a big role in the life of a doctor. I hope that you've learned from it and you're willing to like look into it in the future as well and just do a bit more research, because it's such an important idea, and it just leads to a lot of discussion, and I really like talking about medical ethics. And thank you for watching this video again. Be sure to check out other videos on the Study 2 Project channel, and to check out my own personal channel, which is Tolu Duckworth. And yeah, stay safe, be active against racism, and I will see you in the next one. Bye.